Hey there, future nurses. Welcome to Guided by Night. I'm Dr. Knight, your DNP nurse educator and mentor. Today, guys, I want to talk to you about nursing assessment versus nursing skills. What makes you a great nurse? Let me ask you something. Your ability to insert IVs, administer IV antibiotics, insert Foley catheters, does that make you a great nurse? Not exactly, right? Here's why. Anyone can learn these tasks with repetition. What defines nursing is your ability to assess, nursing assessment. Your ability to observe, interpret, and act swiftly is what saves patients' lives, not just your ability to perform tasks and procedures. Assessment is the foundation of nursing. This is how we recognize changes, detect early deterioration, and prevent complications in our patients. Like administering medications only works with assessment. You can actually administer the right medications for the wrong problem. This is why you have to be able to assess to make sure you are treating the patient appropriately. Assessment isn't just a skill, guy, it's a mindset. It's actually a mindset that we shift from doing to thinking. It helps us connect the dots, it helps us to anticipate what's coming next. And actually, it helps us to recognize what matters most in our patients. Something like task alone is not enough in nursing. Now, I don't want to just say we don't need tasks because we do. You have to be able to perform nursing tasks, but you cannot just do that alone. They actually go together. Your nursing assessment will help you perform the right task for your patient. So I don't want to just say to, do away with developing nursing skills and tasks. Important that you realize that tasks won't tell you why your patient is short of breath, or it won't help you determine why your patient's blood pressure is dropping. You're going to have to be able to assess your patients. If you only focus on the doing, guys, you are going to miss the subtle cues that's going to keep your patient safe. Subtle cues like the pale skin, patient confusion, delayed capillary refill. These things are going to help you detect things early and prevent your patient from going into any type of cardiac arrest or respiratory failure. Nursing students, new graduates, and even some experienced nurses to realize is that nursing is not just following orders. We are actually thinking. Need nurses that think, not just do. Thinking saves patient lives. Thinking prevents injuries to patient. We have to begin to shift away from doing and start thinking if we're going to improve patient outcomes, guys. Assessment protects the patient and it protects you. Assessment is actually your safety net. When you assess thoroughly, you protect your patients and you. A complete, accurate assessment is going to tell the story. It's going to tell your patient's story. It's going to give evidence to support why you made certain decisions. It's actually going to support your decisions and your communication. And it's going to protect you legally because, trust me, an experienced provider or nurse can really come in and look at the chart and determine if you missed the cues just by looking at the pattern and the trends of the patient or the data that you are inserting into the computer. So I'm telling you guys, nursing assessment is a non-negotiable. Yes, you can develop specific skills like inserting IVs and inserting Foley catheters, but what's going to separate you from every other nurse is your ability to assess. Assessment drives your clinical judgment and critical thinking. It helps you to recognize the cues, interpret the data, and decide what's the next steps for your patient. Every skill you perform actually provides you with some data during your assessment. You don't just check blood pressures, guys. You actually interpret. You don't just listen to lungs. You actually hear the story that your lungs are telling with that wheezing, whether they're clear. It actually tells a story about the patient. You don't just check oxygen. You connect oxygen to perfusion, mental status, and patient safety. I can remember a time when a nurse called me over and she just said, her patient doesn't look right. And there were no alarms, no subtle changes, just her intuition. And because she believed in her intuition, she was able to get the patient treated early. It was determined that the patient was having early signs of sepsis, so she was able to get the team at the bedside right away and prevent the patient from having, severe complication. And the patient ultimately recovered based on her intuition and her ability to assess. So, guys, it's so important that you develop your nursing assessment and critical thinking. Actually, what nursing assessment does, it gives you the power to catch things before they become a crisis for your patient. Let's talk about shifting from doing to thinking, guys, because this is going to separate us from any other nurse. And I know you guys all want to be a great nurse, right? And this is how you're going to do it. You're going to focus on building your assessment, your ability to assess and pick up those cues instantly. When you walk into that patient room, I want you guys to start looking with your eyes. I want you to start using your ears and using your intuition so that you notice when something is changing or something is different about your patient. When you do these things, you're going to pick up things early and you're going to get the right staff to the bedside to treat your patients. And ultimately, we're going to keep our patients safe and we're going to have better patient outcomes. Going forward as nursing students, new graduates, I know you guys are excited about building your ability to insert these IVs, perform all these tasks. But what's most important is your ability to assess when something is wrong with your patient, your ability to act quickly, mobilize the team, and get treatment to the bedside. Nursing in 2025, 2026 is totally different from years ago when nurses were just performing tasks. Right now, guys, we are focusing on enhancing our education so that we can critically think and we're going to keep our patients safe. Skills make you capable. Assessment makes you competent. Clinical judgment makes you exceptional. Don't forget those three things, guys, okay? I'm Dr. Knight, And this is how we're going to be building your clinical confidence and developing your nursing assessment skills, one nurse at a time. Happy clinicals, and I'll see you on the next episode.